This is a comparison of malaria in the United States and Nigeria by Jacob Phillips. First off, we're going to be comparing the differences between malaria in the United States and Nigeria. In the United States, malaria is simply not a problem. The CDC, Center for Disease Control, stopped malaria projects in 1952. On average, in the years since then, there have been 2,000 cases with approximately 6 deaths a year. Malaria is also not a problem because it doesn't survive well in the North American climate. However, in Nigeria, it's an entirely different story. Nigeria is the country with the most cases and deaths in the world. There are over 100 million cases and 300,000 deaths each year. This is half of the world total. In Nigeria, 97% of the population is at risk. So now we have the basic facts about Nigeria. We can begin to talk about treatment options for malaria. First, mosquito nets. Mosquito nets are a cheap and effective way to reduce the likelihood of contracting malaria. Simply by sleeping under a mosquito net, it reduces the likelihood of death by 20%. These nets are only $3 and can last 3 to 4 years. Mosquito nets are quite possibly the best way to stop the spread of malaria in Nigeria. One way that is currently being used in Nigeria to some effect is chemical sprays. These can kill and ward off the mosquitoes that spread malaria. However, these sprays are being met with a lot of resistance because they are harmful to the people and the environment. They are commonly comprised of DDT, which was outlawed in the United States a number of years ago for being harmful to people and the environment. The third major way that we can improve malaria in Nigeria is by improving the drugs and medicine. In the United States, there are 9 different strand-specific treatments for malaria. However, in Nigeria, the best shot is to stay away from hospitals and is to actually stay at home and to try to stay dry and cool. Diagnosis within 24 hours is essential to survival. Basically, there are no drugs and medicine that are able to be used in Nigeria. The cost that malaria has to Nigeria is simply unknown. This is for many reasons. First, it creates a cycle of urban and ruralization. When many people in the cities begin to contract malaria, it forces people to move back out into the country in a process called ruralization. However, people begin to move back into cities due to economy and industry. Once people begin to move back into the cities, called urbanization, it is easier for them to contract malaria and then move back to the rural areas. This process stops the country from developing into a more first or second world country. Another problem is that malaria targets both the elderly and the children. When the children are targeted and become sick, this also takes the parents out of the workforce, further stopping malaria from developing into a first world country. In conclusion, malaria is a worldwide issue. However, it is the worst in Nigeria. This issue needs worldwide funds such as aid packages, social workers, doctors, and nurses. However, this is also an issue that needs soldiers, as many warlords and local militias will take the aid packages for money and use them for themselves. This has been a comparison of malaria in the United States and Nigeria.